Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Suguna from Apollo Cradle and Children's Hospital. She is going to talk about infantile colic. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hi everyone. I am Dr. Sugna. Today we'll discuss about infantile colic. Uh, Infantile colic is a common problem. It is described as persistent excessive crying, one of the most distressing for the infant, and a distressing symptom of the infant, and a distressing for the parents and clinician for the infant. So colic is a colicky episodes are paroxysmal episodes. They are characterized by facial grimacing, leg flexion, and passing of flatus. The criteria for colic. What is colic? What is difference between the colic crying and normal crying? Normal crying, actually cry is a normal for the newborn or infant. So the cry almost the peak onset of the cry is around 6 weeks of age. So the cry around 1 to 2 hours cry is normal for the any infant. So the colic episodes peak onset, it starts around 2 to 3 weeks of age and end by 3 to 4 months of age. So cry is a colic. Most of the colic episodes. What is colic? How to define the colic? Colic is defined by the episode of cry lasts for 3 hours per day, and it is at least 3 days in a week and more than 3 weeks. The symptoms are more than or equal to 3 weeks in less than 4 months of age. We call it as a colic. So another criteria for colic is Rome criteria. That is, if it is starts and stops age less than 5 months of age, and recurrent episodes of crying or fuzziness that starts and stops without any obvious reason. So the etiology without obvious reason, and it is not resolved by any caregiver activity, and no obvious evidence of any fever or illness, or no poor weight gain weight, and it is otherwise healthy child. So and another criteria is Rome. In Rome criteria, five things are there. Another thing is at least the cry is lasted for the duration of cry is more than 3 hours, and total duration of try is more than 3 hours. 3 hours in 24-hour prospective observation. So the cry more than 3 hours in a day, and at least 3 days in a week, and more than 3 weeks it is persisted for more than 3 weeks. It is defined as a colic. So what is epidemiology? So colic not depends on the like no difference between the age until like term or preterm or gestational age of the baby, and sex, male or female, socio-economic status. So the and next thing is etiology of crime. Etiology. So more the colic is a benign self-limited condition. So no etiology, unknown etiology. So other etiology is mostly it is unknown etiology. So other associated etiology are multifactorial etiology. So there is association with cow milk protein allergies, and faulty feeding techniques, and changes in the gut microbiota, or changes in the fecal flora, and increased serotonin levels in the infant with colic and without colic. They observed that infant with colic there is a increased levels of serotonin levels, and their metabolites in increased levels of their serotonin metabolites are observed in the urine, and mm, and maternal smoking is also associated with increased colic in the newborn. So clinical features of the colic. Uh, Colic is clinical features. Colic is persistent paroxysmal persistent excessive crying without any reason. So if on history examination on history, like the episodes of the colic, the episodes of crying will start suddenly. So it's suddenly and without any obvious reason. It starts and ends without any obvious reason, and any methods of soothing methods or any these things will not stop the crying. So an examination until like, so post and cry or colic or post and cry is there, we have to look for the on physical examination any other reasons for the crime, like on skin examination, any trauma, accidental or non-accidental trauma, corneal aberrations, or ear examination to rule out ear discharge, otitis media, and any fractures and any hernias, perineal region for examination for the any diaperdermatitis or inguinal hernias, testicular torsion. These are the organic causes of the crime. So, next, management of the colic. So management depends on the mainly first line interventions are for first line interventions are initial is education and support of the caregiver. Then feeding any and education of the parents, like education of parents or caregiver. So colic, so we colic is a it is a benign symptom. So otherwise baby is healthy, weight gain is good. So first we have to take the anthropometry, weight gain, how is the weight and how is the head circumference, how is the length. So growth is good, so baby is otherwise healthy. So nothing to worry about these symptoms. Mostly it will resolve its own self-resolving. So mostly it resolved by 3 to 4 months of age. So and so it is not associated with any other long-term issues. So educate the parents about colic and soothing techniques. Teach the parents. So soothing techniques like whenever the episode is there, they can use pacifier or swinging, 5S, swinging, sooth, rocker or riding a car or swinging movements, stomach side hold or mm, other soothing techniques like tummy exercises, rubbing on the on the abdomen. These are the soothing techniques. Then, are, if the etiology is or any association with the feeding techniques, so faulty feeding, like sometimes colic may be associated with overfeeding, underfeeding, inadequate burping. So if the feeding technique, if the baby is breastfeeding or bottle feed, depending on that. If the baby is bottle feeding baby, so the feeding in a vertical position and feeding in with the cow bottles. So with frequent burping, changes in the feeding technique, changes in the feeding method. So and other things like uh, breastfeeding, any latching or any issues are there, so correcting these things and avoid overfeeding. So that is also overfeeding or reflex. Overfeeding also will cause these symptoms. So and then first thing is education, then feeding. Any faulty feeding technique is there, we have to correct the feeding techniques. Then if baby is on formula feeding, then if any like cow milk protein allergies are there, we can we can change the formula to hydrolyzed formula or hydrolyzed formula. If the symptoms are resolved within 48 hours, we can if the symptoms are resolved, we can continue hydrolyzed formula. If the symptoms are not resolved within 48 hours, we have to resume previous formula. So if it is like cow milk protein allergies, if you observe, and like if most of the time cow milk protein allergies are there associated with any skin allergies or eczema or blood in the stools. Other symptoms also will be there. If it is there, then only we have to. And if the baby is on breast milk, so we have to avoid breast milk. We have to continue breast milk. Along with that, we have to decrease the consumption of the milk for the mother. And other allergic foods like wheat, these things we have to reduce the mother for mother. And then some studies on the soya milk. Soya milk actually it is not suggested for the cow milk, not suggested for the colic babies. Only hydrolyzed formulas we can try for colic if it is really it is associated with colic. Mm, and then suturing techniques and uh, then these things, drugs. Drugs and other thing is changes in the gut microbiota. So if the actually multiple probiotic is a live microorganisms. They are the good bacteria. If it changes in the gut microbiota, only one probiotic has a role in colic, that is Lactobacillus reuteri, DSM 17 19 900 17 938. Only the one strain is that is if we can try, but that is also not evidence based. Only actually colic with or without a probiotic. With probiotic, crying time is reduced, but not completely resolved. Uh, then if mother is on any alcohol or nicotine, so we can caffeinated drinks, consumption of these things we have to reduce. And if baby is on breast milk, we have to reduce and we have to see for that. And so first and last thing is for colic is a benign self-limiting condition. So educate the parents and caregivers that it is without any obvious reason. So no treatment, mainly soothing techniques and support. uh, then drugs. So many drugs are there. They are like phenobarbital, semimethicone, and diphenhydramine. They has no role in colic. Uh, So, soothing techniques, actually, education of the parents and soothing techniques, mainly to calm the child. So, swaddling the baby, and one more thing is soothing noises like swinging or white noises, uh, slow rhythmic movements, rocking or walking or riding in a car. These also soothe the baby. So colic is very common problem. Almost uh, 30-40% of the babies they will experience this problem. Normally first 2 weeks of the age, normally babies will not cry much, but it will start around 3 weeks to 3 weeks, around 2 to 3 weeks of age. The peak colic is around 6 weeks, 6 to 8 weeks, 6 weeks, around 6 weeks. By 9 to 10 weeks, the episodes will reduce by almost 3 to 4 months. Most of the times, it will resolve its own. And the colic is not associated with any long-term problems. Mostly, sometimes colic, if we observe colic babies and non-colic babies, the colic babies there is an association with temper tantrums, but it is not a some association with temper tantrums. But long-term cognitive outcomes are good, not associated with any atopia or asthma. So, take our message is colic is a benign self-limited condition. So, etiology is unknown. So, there is no medicines for the colic. Soothing techniques correct the what is the problem. So, education of the parents and caregivers, soothing techniques, and any feeding techniques, any faulty feeding techniques are there. We have to correct the faulty feeding techniques. That is the only treatment. And one more thing is avoid overfeeding. Okay, thank you.